Hi there, I'm Stephanie McKeith, the host of the Theta Living Show, and this is Cancer Coach Chat. Today, I'm going to go over the most common myth that I hear from the most amount of people is that cannabis has no medical benefit. So it doesn't matter who you are, I'm sure at some point in time you've heard something negative about the cannabis plant, or commonly referred to as the marijuana plant, which is, side note, a slang term for cannabis. When we're discussing this in a medical field or in a medicinal type of a way, we refer to it as cannabis. So let's dive into 18 reasons or 18 medical benefits that the cannabis plant has to offer. So the first one is that it slows or halts cancer cells from spreading. I have dug up a story that was actually published by the Journal of Molecular Cancer Therapeutics, and that study stated that cannabidiol has the ability to stop cancer by turning off a gene called ID1. Another study from researchers at the California Pacific Medical Center in San Francisco reported that CBD may actually prevent cancer from spreading. That's a pretty big medical benefit. The researchers experimented on breast cancer cells in their lab, and they had high levels of ID1, and they treated them with cannabidiol. The cells decreased their ID1 expression after being treated with this cannabidiol, the CBD, and were less aggressive spreaders. That's huge, making for a pretty positive outcome of the study that they performed. So much so, in fact, that the American Association for Cancer Research had found that cannabis actually works to slow down tumor growth in brain, breast, and lungs considerably. So that was my top medical reason when I did my research for this topic today. That was my top reason, my top medical reason to bust the myth that cannabis has no medical benefit. 1 out of 2 people in their lifetime are going to deal with a cancer diagnosis, and we want to be as fully aware of cannabis as we possibly can, because at some point in your lifetime, in one of your loved ones' lifetimes, you are probably going to consider cannabis therapy for some reason or another. So that was number 1. Number 2, let's continue. Helps to reverse the carcinogenic effects of tobacco and improves lung health. There was a 20-year study published by the Journal of the American Medical Association, and it showed that cannabis improved lung function and even increased the lung capacity of the participants of the study. These researchers were actually looking for risk factors of heart disease when they were doing this study, and they found that cannabis users showed an increase in their lung capacity compared to the tobacco smokers who lost lung function over time. Medical benefit number 3, reduces severe pain from nausea that was a result of chemotherapy, and also acts as an appetite stimulant for somebody dealing with cachexia or losing their appetite for some other reason, whether it be from the cancer itself or chemotherapy. One of the most common reasons for medical cannabis use is for people going through chemotherapy. Cancer heroes who are going through chemo are actually suffering whether they let on or not. They're suffering from severe pains, painful nausea. Nausea is painful when you are having that constant urge, or you're actually vomiting consistently, constantly, repetitively. It is very painful. It's very inconvenient, not only, but it hurts. It's uncomfortable. Having those gastric acids travel up and down your esophagus erodes that delicate lining, and it becomes very painful. Loss of appetite is a huge side effect from chemotherapy as well. These symptoms can lead to further health complication. As I mentioned, eroding that delicate lining of the esophagus can lead to further problems. Losing weight is unhealthy. Losing your nutrients, whatever you eat, if it's constantly coming back out and you're not absorbing, you're not getting the nutrients out of your food that you intended to in the first place. So cannabis can actually help with these side effects. It can help lessen these side effects. It can reduce pain, decrease nausea, and stirs up your appetite. Medical benefit number 4, helps people suffering from PTSD. If you are unaware of what PTSD is, it's post-traumatic stress disorder. Anybody dealing with a cancer diagnosis is at risk for dealing with PTSD. The diagnosis of cancer itself is traumatizing. Going through life with cancer after receiving that diagnosis is living with PTSD. And this diagnosis happens to be on the approved conditions list for treatment by cannabis. Fun fact, in New Mexico, PTSD is the number 1 reason that people get their medical license to use cannabis. Naturally occurring cannabinoids similar to THC, tetrahydrocannabidiol, helps to control the system that causes fear and anxiety in the brain, which results in these sensations all throughout the entire body. So we can use cannabis therapy to calm down the effects of PTSD because it actually calms down the brain and all of the reasons that the brain triggers these physical manifestations such as anxiety, nervousness, social disorientation, sweating, shakes, tremors, all of the things associated with PTSD. So moving right along, medical benefit number 5, cannabis therapy can decrease anxiety. So we had a group of researchers at Harvard University brought to the forefront that yet another of this particular herb's medicinal benefits are for people suffering from this condition. And if this is something that you're dealing with, you will agree, in fact, that this is a medical benefit because it can assist in reducing anxiety, which improves your mood, and even in some cases acts as a sedative when we are dealing with anxious moods, anxiety, panic attack situations. Being able to calm down is not something that we can achieve on our own. We need some type of external intervention typically. And for those of us who do not want to use a pharmaceutical agent and we want to incorporate a more natural substance such as cannabis, the sedative type feeling that we get from this herb is very beneficial in calming the nerves. Low doses are key though, because we can actually have a reverse effect or a bidirectional effect, which means that higher doses may increase anxiety and make you more paranoid. So if you decide to incorporate cannabis therapy for reasons such as anxiety, you're going to want to make sure that you're working with a skilled professional, a cannabis consultant or specialist of some sort. Medical benefit number 6, treats glaucoma. The reason that we can say that it treats glaucoma is because it lowers the pressure in the eye, which is what results in glaucoma. Medical benefit number 7, it prevents Alzheimer's. THC slows the formation of the amyloid plaques by blocking the enzyme in the brain that makes them. Medical benefit number 8, soothes tremors caused by Parkinson's disease. So we've got studies recently done by scientists in Israel showing that cannabis inhalation can remarkably reduce pains and tremors and allow for improved sleep for Parkinson's disease patients. What was impressive about the research was the improvement of their fine motor skills in addition to improving their sleep and the progression of the disease in Parkinson's patients. So hitting on multiple levels of improved health benefit for somebody with Parkinson's. Medical benefit number 9, it can control epileptic seizures. This is another huge category, pretty close to the cancer category. It's been found that THC can actually control seizures because it binds to the brain cells that are responsible for controlling that excitability and that excitability factor and regulating the relaxation. So calming the excitability and the overstimulation of specific brain cells, and also being able to regulate relaxation to produce a feeling of relaxation in somebody who's suffering an epileptic seizure. The results of this study were published in the Journal of Pharmacology and Experimental Therapeutics. Medical benefit number 10. Cannabis can actually ease the pain in multiple sclerosis patients. Cannabis works to stop the negative neurological effects and muscle spasms caused by multiple sclerosis. The Canadian Medical Association published a study that suggested cannabis may ease painful symptoms of multiple sclerosis. It was found that THC, which is a cannabinoid found in the cannabis plant, binds with specific receptors in the nerves and in the muscles to relieve pain. Medical benefit number 11, cannabis relieves arthritis. A huge percentage of the American population is dealing with some type of autoimmune issue, namely arthritis. Various types of arthritis. There's subtypes. There's all different kinds of arthritis that somebody could be dealing with. And cannabis reduces pain and inflammation and promotes sleep for somebody dealing with this particular diagnosis. Medical benefit number 12, it helps with Crohn's disease. Cannabis may be helpful in the possible or potential curing of Crohn's disease. Crohn's disease is an inflammatory bowel disease or disorder that causes pain, vomiting, diarrhea, weight loss, and all kinds of other characteristics that may fall under the Crohn's category. Israel scientists have done multiple studies on irritable bowel. It is one of the main categories of study, actually. Migraines, irritable bowel, and fibromyalgia are of the top 3 that are being studied by cannabis. And these Israeli scientists found that the disease symptoms in an average of about 10 patients out of every 11 had been significantly reduced. So their symptoms had been significantly reduced in 10 out of 11 patients. That's a pretty significant number of people who found relief by using cannabis for a medical reason. Medical benefit number 13, improves symptoms of lupus, which is another one of those autoimmune disorders that I had already mentioned. This disorder is when your body attacks your own body. Your immune system sees something in your body as an invader, one of your own guys, your own people, your own cells, and sees them as an invader, and your body attacks itself. Medicinal cannabis is used to treat autoimmune disorders. It's actually believed that certain compounds that are present in the cannabis plant are responsible in calming the immune system down and saying that's okay, you don't have to attack yourself. We are not our own enemy. You can calm down, and this helps to reduce or deal with symptoms for a lupus patient. The rest of the positive impact that cannabis offers is more than likely from the effects of reducing pain and nausea that these patients tend to feel, because when we're dealing with a lupus or autoimmune disorder, there are a lot of different symptoms, and they can either be very common or very unique to the individual. So when it comes to autoimmune, anything goes, really. So when we are using cannabis to lessen the degree or the extent of symptoms being suffered, and we can actually gain medical benefit, that's a myth to be busted. Medical benefit number 14, cannabis protects the brain after a stroke. Rat, mice, and monkey research. I know animal research, animal studies, it makes me very uncomfortable. I know it's something that scientists have been doing for decades, and we need to understand this plant and many substances in depth and more. Animal studies are the only thing we happen to have right now. We are diving deeper into human studies, but I'm going to report on rat, mice, and monkey research that we have right now because that's all we have in regards to stroke. The University of Nottingham are the ones who used the rats, the mice, and the monkeys, and in their studies, they were able to show that cannabis was protectant of the brain by protecting it from brain damage from the stroke by reducing the size of the area affected by the stroke. So it was actually able to shrink, if you will, the parts of the brain that were affected by the stroke. This is what we can categorize as a neuroprotective, which is something to really pay attention to and to really look for when you're diving into your cannabis research like I do. It isn't the only research that's shown neuroprotective effects from cannabis, actually, either. We have other researchers that showed that this plant can protect the brain after other traumatic brain injuries like concussions or accidents, anything that happens to injure the brain. It's been proven to the extent that the FDA has a patent on a synthetic lab-created version of a cannabinoid because of its neuroprotective benefits. It is an undeniable medical benefit to the point that the FDA said, we can't deny this. There's such an incredible benefit by the cannabinoids that we're going to have to create a lab-created synthetic version of the cannabinoid and patent it so that we can capitalize on this too. Medical benefit number 15, it controls various other types of muscle spasms. So it's shown effective in soothing bowel spasms, diaphragm spasms, and other muscular spasms. Medical benefit number 16, treats inflammatory bowel disease, just like Crohn's, but different. Patients with other inflammatory bowel diseases like ulcerative colitis could benefit from cannabis use as well. The University of Nottingham, again, researchers have found that constituents in cannabis, including THC, the one that a lot of people are afraid of, but showing many medicinal benefits, and cannabidiol, which we refer to as CBD, the one that doesn't give you the high feeling. THC gives you the high feeling. CBD does not give you the high feeling. Both, however, are considered to be psychoactive because they alter the frame of mind. One gets you high, the THC. One does not, but can have the ability to calm you down or give you a sedative, relaxing type feeling, which is an alteration in your psychoactive state. So, the THC and the CBD were actually able to interact with cells in the body that play a very important role in gut function and immune system ability. THC-like chemicals made by the body increase the permeability of the intestines, allowing bacteria in. This is a natural biological process. Our brains produce our own endocannabinoids, and the study is showing that our own endocannabinoids are actually increasing permeability of the intestines, allowing bacteria to come in and enter the intestines. The plant-derived cannabinoids, the ones that we extract from the cannabis plant, are able to interact with the cells in the body that play an important role in gut function and immune system ability. And they are shown to block our own endocannabinoids by stopping the permeability and allowing the intestinal bond to strengthen and tighten, helping to reduce the effects, the symptoms, and actually reverse the irritable bowel disease. Medical benefit number 17 helps to eliminate nightmares. This is a bit of a complicated one. I'm just going to go brief over it. We could dive deep, but that's going to take a lot of time because this can be a little bit tricky because it has the potential to result in a positive or a negative effect. because cannabis can actually disturb your sleep cycle by interrupting the later stages of your REM sleep, your rapid eye movement sleep. However, people who are suffering from serious nightmares, especially people who are dealing with PTSD, again, somebody, not just a veteran, but somebody with a cancer diagnosis, somebody who was in an abusive relationship, somebody who had a traumatic childhood. These are all forms of PTSD. Studies are showing that the cannabinoid therapy can actually be helpful by interrupting this REM stage of sleep when these nightmares are happening, because we are intervening at that point. By interrupting the REM sleep, those dreams don't happen. They're not occurring. Researchers show that the cannabinoid THC, the psychoactive one, allows for a decrease in the number of nightmares in patients who are dealing with PTSD. This is the forget category of the endocannabinoids responsibility. If you've ever heard me give a presentation or talk about cannabis therapy, or if you've been to one of my cannabinoid classrooms, I talk about the main categories that cannabis takes care of: our ability to eat, sleep, forget, protect, and relax. And this particular instance, when we're dealing with nightmares, we are dealing with the forget category. We are forgetting to have this repetitive, harassing memory interrupting our life over and over and over. Cannabis can actually be a better sleep aid than pharmaceutical medications, obviously, because it's not causing a plethora of side effects or doing damage to other tissues or organs that pharmaceuticals have the potential to do. Over-the-counter medications, same thing, because they actually can have worse effect on your sleep if you take them for an extended period of time. And like I said, they come with a huge list of side effects. Not to mention, it only makes sense to start with the internal system that regulates sleep. The endocannabinoid system regulates sleep. One of its responsibilities is to create homeostasis in your sleep patterns. So supplementing with cannabinoids sounds like a pretty logical place to start when we're trying to manage our sleep, which is when these nightmares are happening. And my number 18, the 18th medical reason that cannabis can be beneficial, is that it protects the brain from concussion and trauma. The Journal of Cerebral Cortex put out research that showed the possibilities of cannabis being able to help the brain after concussion or other traumatic brain injuries. Cannabis actually lessened the bruising of the brain, and it helped with healing mechanisms after these traumatic injuries occurred. There was a Harvard professor of psychiatry who paired up with a cannabis advocate, and they discussed writing an open letter to the NFL commissioner saying that the NFL should stop their players from being forced to be tested for cannabis or marijuana. Reason being is because of the high incidence of concussions that these players are dealing with on a consistent basis. Over the long term, when they get older, after a player's season has ended and they are into their retirement age, if they're not dealing with the short-term effects of this constant disruption to the brain or these constant concussions, the long-term effects are devastating. So there was an open letter that was sent to show the medical benefits that cannabis has on reducing the effects of brain injury from concussion. So, for my Cannabis Mythbuster series, these are 18 benefits of cannabis that I wanted to share with you today. They are among the countless medicinal benefits that this plant has to offer. These aren't the only ones. These are the 18 that I wanted to share with you right away, real quickly, and they're very common. These are very common diagnoses that people are dealing with. To some, it may seem puzzling. how cannabis is still not legal in every single state and still retains such a negative reputation when we have such substantial evidence to show that cannabis does have medicinal benefits. That's the unfortunate effect, though, when we're dealing with political propaganda. As we continue to study, and we are studying more now so than ever, we have quite a bit of financial backing in private and university study happening right now in the United States. Up until the last couple years, most research has been done overseas. Since the 2018 Farm Bill, we have more finances being poured into medical cannabis research. So we do have human studies happening at this point in time. But hopefully in the near future, medical science will continue to prove its benefits in more fields and make this plant a comfortable, reliable resource for almost all health-related issues, physical and emotional. If there's a medical benefit you're wondering about and you'd like to ask or you want me to cover in my next Cancer Coach Chat Mythbuster series, let me know. But for today, those are my top 18 Mythbusters on showing you that cannabis does have medicinal benefits.